Everybody, John Gucci Foley back with you. Today we have Dr. Chris Honey. Now, he's a professor and the head of neurosurgery at Vancouver General Hospital. This guy's a real brain surgeon, okay? And we're going to talk about the connection between fighter pilots and brain surgery. And here's what's interesting. There's a lot of connections there. We'll get into the process and then more importantly, the mindset of greatness, right? Looking at how are these neural pathways, these reward centers kick in. But really, most of all, I mean, you're going to have a fun time as I did as Honey, and that is his last name, but now his call sign, and Gucci unpack everything from some of the esoteric things of where does altruism come from? Can you map that out neurologically to what you're thinking about or to letting go and just do this idea of how the brain works? So stand by, Gucci and Honey, ready, hit it. Hey everybody, I got one of the top neurosurgeons in the world. Now, he wouldn't say that, but I know it's true. And Dr. Chris Honey, Gucci here, new call sign for you is Honey. How are you, buddy?
I'm good, Gucci. Thanks, man. Thanks for having me on. What an honor to be here.
Well, it's an incredible honor. I got to tell you, I so much have been looking forward to this interview because I want to learn. I want to learn from you. And I know our audience wants to learn from you. There's so many things, you know, when you talk about the head and professor of neurosurgery, that's a big title. You know, it's like, and I want to break this down into how does it affect people's lives? You know, you wrote a book called The 10th Nerve. I can't wait till we get into that. You've also are part of the, besides being a professor and speaking all over the world, but you and I just learned that you're the director of the Canadian Football League, the Players Association. What is that?
Yeah, so the Players Association, and we have a Canadian Football League. It's kind of like your National Football League.
Yeah. No,
Slightly different rules, longer field, and more and less downs. So lots of passing. But the football is a sport where you're at high risk for concussion. Yeah. And the players were going to the team doctors and saying, you know, I feel out of it. And the team doctors were saying, you look great, go back in for the fourth quarter. And so some of the players felt like they might not be getting the best advice. And so they turned to their Players Association. And then the Players Association asked me to come in and speak on their behalf and be like a second opinion. So now if any of the players feel uncomfortable, they can come to us. We can diagnose them. And the only thing we care about is the player. We don't, I'm not paid by any team, or in fact, this is pro bono. And so all I care about is how the player is doing in their future. And so the players are able to get a second opinion and are basically looked after by doctors. And then now the team doctors know there's someone looking over their shoulder, right? And it's turned the corner. Oh yeah, we care about our players. We care about our players. And so that's nice. That we're looking after the players who are putting their life on the line, you know, for this sport.
Well, first off, I just want to say thank you. I played football in college in the States. We just had the Super Bowl yesterday, so you know we're going to be. This will get out here pretty soon, but so there's a lot of attention there. But I just want to say thank you for doing that. The players need you.
Well, the whole world has been looking at Phoenix, right? Because you had the WM Open, the PGA.
Oh yeah,
you know, the most exciting golf tournament in the world, and the Super Bowl same weekend. So good for you. And even in Sydney, they're talking about Super Bowl. So it's a worldwide phenomenon. And I love it. And Rihanna is from Barbados, and I was born in Barbados.
Oh, I didn't know that. Oh, let's dive in. And I also heard that you were an Olympic diver. And so I want to let's get your background first. Then we're going to dive into the psychology, the neuroscience behind high performance. We're going to look at, you know, how you were impacting people's lives, what you learned from not just treating the disease, right, but really understanding,
listening to the patient. Well, I'm going to say there are common themes in anyone striving for excellence. And I'm reading this book. I don't know if you've ever seen it, but I'm reading this book. And it's called Fearless Success. And some of the themes ring true. Yeah. That's exactly right. And so I think there are are common threads that run through the veins of all people who are strive for success, whether you're a fighter pilot or or a brain surgeon.
Let's unpack some of those right away, because I can't think of anything more elite than a brain surgeon in the form of surgery, and in the pilot world, being a Blue Angel. So there's a lot of similarities there, but there's probably some slight differences too. But let's unpack some of them. So you said you were just reading the book. What strikes you as similar between a brain surgeon and, let's say, a Blue Angel?
I think there are some people in the world who want to do things because they are hard. We choose to do these things and the other things and go to the moon, not because it is easy, but because it is hard. And
I like your accent. I like the accent. That was beautiful.
My Boston accent. So I think that runs true, whether you're a fighter pilot or a neurosurgeon or a Marine, right? Why do you go into the Marines? You go in because it's difficult. Right. And you want to do something that is hard and stretch you, and there are people who want to do things that are easy. Okay. There are different people in the world, but I would say neurosurgery and fighter pilots share. I'll tell you one thing though. Neurosurgery has a combination, and I think fighter pilots share that. There's an intellectual challenge, like trying to understand the patient, trying to figure out what is wrong and come up with a solution. And then there is a physical challenge. Are you coordinated enough to do the operation that patient needs? And I am guessing that rings true as a fighter pilot too. There is a huge cognitive difficulty with what you are doing, and then you have to have the physical ability to pull it off. And so I'd say that's the challenge.
You just nailed it. I'm thinking about, really not even just fighter pilots or neurosurgeons, but high performance, or really anybody who's listening to this, right? If you want to become the best at what you do, or even just become better, what are some of those not skills, but really more importantly, the mindset? So as I heard you talking, I was thinking about, really, let's dive into the mindset of greatness, right? This cognitive piece, but also there's a physical piece. So it is a mind-body connection. In the jet, let me explain this, and then I want to hear about you doing surgery. I've got to be prepared mentally. I mean, I've had the brief, I've visualized what's going to happen, but I know the minute I get airborne, things are going to change. So we call it situational awareness. Where's if I'm upside down and I'm inverted, I have an enemy over here, I'm getting lit up over there. But at the same time, you got to be focused, right? So this ability to focus down yet open up is something that I've noticed, and some of it's not really taught. It seems like the people who really have that natural ability seem to be able to do that. Do you see that in surgery, in neurosurgery?
Yeah, very much so, very much so. So the situational awareness is like a blood vessel can start bleeding unexpectedly. You need to know how to do that. And you have to be performing at that moment below your cognitive levels, like almost just flying on autopilot. Yes, right. I'm going through, but I'm available to now focus on this thing that changed. I'm going to deal with it. You can't be doing an operation at your maximal level and then have something come on top of it. And so I think you need repetition so that this what seemingly hard operation when you began your career. No, this is Tuesday afternoon for me. I'm going to go through this and remove this tumor, and then have something unexpected. Okay, I'm ready to respond to that. And the corollary in sports is always there, right? If you're at a certain level athletically, you go to another level when you're intellectually up your game. So if you can hit the tennis ball, it becomes an intellectual game. Where is the third shot from now? Because I know how to hit a forearm hand, and I know how to hit a backhand. And same with squash and soccer and all those sports where, I know how to kick a ball and run, but Pele is able to see the whole field at once and know what's coming up in the future. That's a combination of intellect and physical. And I think it runs through at many sports and activities at high levels.
Well, and that makes me think about the concept of flow. I like what you talked about, where you have to be operating below your capacity, right? I call that nibbling the envelope, by the way. Like if you take a jet to the absolute limit, that it can go. And that's defined by aerodynamics. So it depends on your airspeed, your altitude, your G-forces. It'll be different, but it's an envelope. They actually call it an envelope. In test pilot school, there's a graph and it shows the envelope of where the airplane, and I call it nibbling the envelope, because you want to touch that edge. But if you go beyond the edge, it's called a departure, and you're no longer flying. You're along for the ride, right? Mm-hmm. And I've also noticed you can't stay on that edge. It's like a downhill ski racer on the very edge. You can't stay there the whole time. So I thought about hitting the envelope and backing off. Hitting the envelope and backing off. That's just in my fighter pilot world. How do you see that?
Yeah, it's a little controversial, and I'm going to step out on an edge if you'll let me. So there is an edge in neurosurgery beyond which you can't go. You cannot pull a blood vessel beyond a certain amount or it will tear. How do you learn how hard you can pull that blood vessel before it tears?
Right.
That depends on your personality. There are some neurosurgeons who pull the vessel until it tears and say, now I know. And at the beginning, they are wrecking people.
Yeah.
And at the end, they can become technical masters because they've been over that edge so many times. And so 10, 20 years into their career, they're lauded. But at the beginning, they're just terrible. My personality, I couldn't go over the edge. And so I am a slower operator than I could be, than some of my more technically gifted, colleagues. And so I have learned by almost in a scared fashion, sneaking up to the edge, sneaking up a little closer without the bravado of, going over the edge. Now, so I think there was a difference between brain surgeons and fighter pilots, because they call brain surgeons brave, but they're not.
Right.
They're playing with someone else, whereas the fighter pilot is playing with their own lives. And so I think the brave neurosurgeon can sometimes be the psychopath. And there are psychopathic surgeons who are technically very good because they don't feel the emotional letdown of wrecking someone. And they've gone over that edge and they know exactly where that envelope is because they've looked at it from both sides.
Wow.
And I'm a little, and it's just personality wise, I can't look from the other side. I would, I sneak up. And so I think there's similarities, but also there are differences.
Yeah, 100%. No, I like where you're going. Use the word scared, which I think is beautiful, by the way. I was scared a lot. I mean, when I was flying, I'm scared. To me, there's a difference between being scared and being afraid. And I'm kind of curious to hear what your thoughts on there. To me, scared is awareness. It's what you were just describing. I'm aware I can't pull this blood vessel too far, but I'm still nervous in doing it, right? Or at least I'm aware. It's an awareness piece. How would you describe, and is that a decent analogy to really talk about a higher concept of awareness, this awareness?
Yeah, I would agree with awareness. And for me, scared has a connotation of the autonomic nervous system is upregulated. Your heart's going, and you can't have that during surgery. If you get an adrenaline or a sympathetic rush, everybody gets a tremor. And then it just gets worse and worse and worse. So you cannot activate that autonomic system in your brain, which is the fight or flight response. And so you better be calm. You can be very aware that you're getting near something dangerous, but you cannot let it trigger that adrenaline release, because then you can't hold the instruments under the microscope.
Wow. Now, how do you learn that? How do you learn that yourself?
I think practice. Yeah. Thousands of hours of practice and knowing what you're comfortable with. For me, I do enjoy. I enjoy surgery, right? I'm far enough into my career that it is not at my limit. I'm not nibbling at the envelope when I'm operating. I'm enjoying the day. I can't think of spending a more pleasant day. I really enjoy my surgeries. But there are times when I understand that okay, this is tiger country. And sometimes at my stage in the career, they come to you, right? Because you've got the most experience, and now like no one else can, what do you want to do? And so I think you have to have an honest and frank discussion with the patient, and of course, do your best. But you have to be attuned to your body. And if you let it out of the bag and you're starting to get, you've got to back off. And why can't you back off, right? Why can't you be humble and say, no, this is too hard. This is too dangerous. I'm not risking the patient's life just to see if I can do this.
Yeah, I used to have I had a friend, another doctor friend, and he said he went through the debrief on the Blue Angels, and I want to dive into that concept in surgery, the idea of preparation, execution, and then the debrief, right? But he made the same point you did. He says, Gucci, he says, there's one big difference between you and I. I said, really? What's that? And he says, well, and it was your point. He says, if I make a mistake, if you make a mistake, you die. If I make a mistake, the patient dies. So, and so we laughed a little bit about that. But I want to get back to the concept of the process side of a successful enjoyment surgery, the preparation, the actual surgery itself, and then post-ops. What is that like in your world compared to a fighter pilot world?
Yeah, so interestingly enough, two things. I want to touch on two things, if I may. One is team, the creation of a team. So the team that surrounds me is fabulous. I love these people. And one of the things that we teach is that anybody can speak up and say, hey, I'm not comfortable. And we learned that from the aviation world. Yeah. Where historically there was a very pyramidal structure and nobody told captain, we're running low on fuel, or maybe you turned right instead of left. And so, Swiss Air goes into the ground because the lieutenant couldn't say, like, we got to dump and land. And so now, following the aviation's lead, we now have checklists. Yeah. And a culture in surgery where the medical student can say, what are you doing? And I try and create that in my OR. So it's not Professor Honey, it's Chris. Oh, and we introduce each other at the beginning, and we say what our roles are. Hi, I'm Chris. I'll be doing the surgery. Oh, hi, I'm Lynn. I'll be assisting. I'm, and so on. And so anyone can say that. And so I have backups. It's not just me. If I make a potential mistake, God forbid, someone's going to catch it. And someone's going to feel comfortable saying, are you sure we need to, and so I've got this support team around me and I can relax and go. Yeah. So that's one thing I wanted to say. Team is crucial. And if you can generate and this is very surgeon specific, but if you can generate a positive attitude in your OR, people flock to you. I want to be on that team. Can I be on that team? Can I stay on that team? Can I move to that team? And so all of a sudden you self-select for the best of the best, the best nurses, the best anesthesiologists, and then you're flying like it's such a pleasure. Yeah. But I will say we have learned in surgery a lot from aviation. So now we have checklists. Yes. Hi, I'm Chris. I'll be doing the surgery. This is my patient, John Smith. Is that the band on his wrist? Yes. And John is here to have his tumor removed from the left side of his brain. Is that correct, John? Yes, it is. John has no allergies and blah, 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 blah. And we go down through the lists, and it's sort of, there's another list later on. So there's an introductory timeout. There's a formal timeout, and it's actually called a debrief. There's a debrief at the end of the surgery. Did we do the surgery? Were there any complications? Who are we handing this patient off to? What are the issues that we need to know? And then the patient moves safely, because whenever a patient moves from one doctor to another, there's a potential for catastrophe, right? Whenever there's a change, you're flying, you're fine. Now you're landing on a plane, on a boat. There's a chance for a problem, right? There's a change. And so those sort of checklists have followed aviation. Yeah.
No, I love it. And it's amazing that you guys have incorporated that so well. Do you adopt the debrief in your surgery unit now? When do you do it? Is it in the actual surgery? Is it outpost? I mean, how do you guys do the debrief?
Yeah. So typically the surgery's done, skin is closed. patient's still asleep. They're just starting to wake up from the anesthetic, and there's like 5 or 10 minutes where they're lightening up, lightening up, lightening up. Now they're awake, and then you extubate them. And there's that 5-10 minutes when we're standing around. And so it's almost immediate, patient's still in the OR. This was a clean case. There were no complications, or I found something I wasn't expecting. Who's taking over? And yeah, so that's where the debrief is.
Yeah, that's great. We did it. I think it's important to do it immediately with the team that's there. You know,
Yeah.
we would do it right after the air show. I mean, we would have to budget the time. We would sign autographs first. We go to the crowd line, and then we would debrief, right? But you
Yeah,
mentioned
we're
something.
not signing autographs.
Well, yeah, you're doing more than that.
Yeah, no one wants my autograph, I'll tell you.
Oh, they do, and they will after they read your book. And
I don't know, Gucci, but anyways, I'm just delighted to chat with you.
Well, you mentioned something really important. I want to dive into it. How do you create the environment for that positive environment, or I would call it a glad to be here environment? You know,
Yeah.
I'm wearing that shirt. That actually is an ethos of operational excellence. It's funny I use operational, but excellence and appreciation, gratitude, and this camaraderie and this chemistry, right? So how do you build it in your teams? The appreciation, the glad to be here.
Yeah, the truth is I've not done it deliberately. It's just come organically because I am glad to be here.
Yeah. Okay.
I love my work. I can't wait to get back into the OR. Like, I really, really enjoy it, even the hard stuff, you know? And I think people pick up on that. And a little bit of your personality, like I don't chew people out in front of other people. You know, I'm respectful. But I'll tell people when they've done something wrong, but I think that they'll know I'm telling them because I don't want them to do it again, not because I need to step on them to feel taller. And I think that's just a personal thing. And we're polite, we're cordial, we're professional. And then we have an ethos of teaching. So you typically teach one neurosurgeon a year from some country who will come and spend a year in Vancouver learning the kind of surgeries that we do so that they can go back to their country and do that surgery. So there's always someone there who's, you know, being taught. They're a fully trained neurosurgeon from their country or Canada or the US, but they just want additional experience in the kind of surgeries that we do so that they can go back. And there's a learning curve. Learning curve is any technical skill, flying undoubtedly, surgery for sure. And you have to get up that learning curve at some point. And it's nice to be under the wing of a neurosurgeon, and you're going to do 70 of them in Vancouver, and you go back home and no one's done more than 5. And now all of a sudden you're coming in having seen 70. You feel pretty comfortable. And so I think it's just like getting the hours in a cockpit.
Yes.
And there's always someone on the, I guess you would say, on the right side of the plane learning.
Well, I love that because, you know, what you just did is on the Blue Angels, we were always hiring instructor pilots. So because I want to be able to teach someone else. You're 1 year being taught, even though you're highly skilled, like a surgeon coming in, and then getting taught. And it's funny, it's a year that you did that. Is that called a fellowship? Is that what that is?
Yeah,
okay.
A fellowship. Absolutely.
And
we've had a couple of fellows from Australia. And so now I'm in Australia, teaching the rest of the neurosurgeons, the kind of thing that we do.
See, that is so cool. And that's why I'm so excited about what you do. You're not only really good at what you do, but you realize now that it's passing that along. It's scaling, the greatness and teaching others. And that was the key on the Blues, having that purpose higher than self. But it's also unique to be around others who want that, because not everybody's driven. You know, it's back to what you said earlier, right? You got to really want it, this joyful effort. In fact, I want to ask you now, I want to move from process to mindset, because when you say you're in a surgery and you're just enjoying it, what does that feel like? What is your mind going through? What does joyful effort mean to you?
Wow. I think the human brain is set up to reward. If you have a desire and you accomplish it, you get a reward, you get a dopamine hit. And it sets up, so happiness, I think, happiness is attaining your goals. And you can do that either in a Buddhist fashion by setting your goals very, very low and like enjoying a sunset. And you can reach that goal if you can truly believe that that is your goal. That might not translate to success in society because society looks at the level of your goals. And, you know, you want to go to the moon, society, oh, wow, you know, but you're not going to get there. And so I think setting appropriate goals and attaining them is a key for dopaminergic hits in your reward center in your brain, and you feel happy. And so I've always tried to be humble with my goals, but that grates on my personality.
Yes.
My personality is like reach. And so I have a series of goals, some of which
Yes.
I will never attain. What is the poem? A man's reach should or exceed his grasp, or what's the heaven for? I have some very lofty goals, but I've got some attainable goals. And attainable goals, it would be performing a surgery beautifully.
Yep.
And I can do that, you know, most of the time because of just done so many. And so I can pause or appreciate when it's going well. I don't take it for granted. God, that was a nice operation. You know, that was great. And so you get those hits all the time. Yeah, when you're working.
Oh, I love that. I love that.
And occasionally, you know, and we have done, we've done surgeries that no one else in the world has done. Wow. And, you know, those are those, you know, reachings. But that's rare, right? Right. And when that's huge, when you're able to introduce an operation that no one's ever done before and then try and let the world know about it. That's why I'm in Australia. Yeah.
Wow. Well, what I heard you talk about, I heard once called, you know, step goals, having step goals. But also what I want to talk about, what's more important is, what are some of those lofty goals that you have? Give me one that you have. And then what's your game plan to get there? How do you address something like that?
Discover a new disease and cure it.
Yeah, there you go. Wow.
I've done two.
Really?
And we've got a third on the way that we don't want to talk about yet, but we think we understand it. And these are diseases. And it's really the crux of the book. So as a surgeon, we're sort of taught not to emotionally connect with our patients, because
really?
they'll bring you not to emotionally connect with your patients, because they'll take you down when you fail. You'll get euphoric when it's too fluctuating in terms of emotion. And when emotion comes in it dulls your cognitive logics. You know, let's do it. It's such a beautiful young child. We've got to, you know, maybe that's not the right thing. You need to be very intellectual about it. But having been trained not to emotionally link with my patients, there have been some patients who have left an indelible mark on my soul. Wow. And I have a series of patients who absolutely changed who I was. The patients changed me. Yeah, right. I know it's my job to change, but they changed me. They changed how I perceive the world, how I perceive myself, and how I perceive medicine. And one of them, and it turned out to be a group of them, forced me to rethink my understanding of medicine and conceive of a new disease. And so in medicine, we're taught to recognize patterns. Yep. Oh, you have a fever, you got a cough, and your x-ray looks like there's flu. Oh, you must have a pneumonia, right? So these sort of patterns of illnesses. But what if the pattern of illness you have doesn't fit with anything I've ever been taught?
There you go.
Okay, so I'll tell you, the knee-jerk reaction is to blame the patient. I don't recognize what you got. You're making this up. Or it's all in your head. You've got a psychosomatic disorder. You've got stress caused. And so I had a patient with a disease that was causing intermittent choking and intermittent coughing. And it didn't fit asthma, COPD, anything. And what it was was a blood vessel in their brain pressing on the vagus nerve, which leads to the throat and causes contractions, and leads to the lung and causes a tickling sensation. So if you bang your elbow, you get this tingling sensation in your hand.
Yep.
If you went to a hand expert, they'd say, you're making this up. There's nothing wrong with your hand. You must have a psychiatric disease. No, don't look at their hand. The problem was in the elbow. And same thing in this, there's nothing wrong with your throat. You're making this stuff up. There's nothing wrong with the problem was up here, a pressure on a nerve. And we did an operation to relieve the pressure on that nerve, and their choking and coughing stopped. And so my goal now is to disseminate that information. And what is interesting, and maybe the same thing is true in aviation, I don't know. But in my world, in medicine, you come along with this sort of maybe paradigm shift or something completely new, and the old codgers like myself say, "Nah, I don't believe you. You know
Right.
what? I've never seen that, and I'm 30 years of surgery. I've never seen it. You never looked. It's been there." And so now we're looking back in history, and in the history of neurosurgery, back in the 30s and the 40s, there was no CAT scan or MRI, but there were very good doctors who wrote beautiful notes describing it. And you look back and they're there. We found 26 cases of it back in the, in the 40s, describing these patients but they didn't know what was wrong. But back then they just, wrote out the beautiful story. I had this, person who had choking and coughing, and we can look back and see that this disease has probably been around since there were humans, but only recently has been recognized as to the cause. And so that was a huge reach for me, and yeah, I love it.
Let's get back. Wow, what a story about discovering something that other people hadn't seen. But it gets back to perceptions, right? And I want to dive into this idea of, you said this patient changed the way you perceive the world, which I think is a big comment, because I believe the world's coming from us, not at us. So we will perceive things differently. I mean, you and I can watch the exact same thing, and we'll perceive it slightly differently, yet there's a lot of common too, right? So let's get into how the brain works on that. First off, the concept that the world's coming from us, not at us. How does that sit with you?
Wow. That is an interesting concept and difficult to understand. And I'd like to bring in my friend Socrates, Plato, and Aristotle to
exactly, because that's where it's coming from. That's exactly
you're talking about thinking.
Right.
Yeah, and yeah, I'm gonna say you're way over my head, man.
I'm not over your head. I want to get,
man,
but I want to get in.
But you get into your mindset where you try and force the world into your understanding of it, and you're distorting the reality of the world to fit your rectilinear way of thinking. And what I'm saying is you have to listen to what the reality is, and they'll tell you. So this is something that has been a recurrent theme when I talk to physicians, and that is we've gone really technical.
Yeah.
Don't tell me about the patient's family history or what kind of job they did. Show me the MRI. What's the anatomy? Where's the tumor? And I'll take it out. And what I'm saying is we've gone way too far that way. You have to listen to the patient. You can go technical if it's already within your realm. So if you're doing brain tumors, yeah, show me the tumor. I'll take it out. But if you come across something you've never seen before, you have to open up and be prepared to listen to the patient, and they will tell you what the reality is. I am having this problem where every few days I have this incredible choking sensation and I can't breathe. And then I'm normal. Wow. Okay. And so the first patient who came to me was a young lady, and I just believed her. And I said, okay, let's try and figure this out. I honestly don't know what's wrong, but let me try and figure this out and tell me some more. What else do you get? Oh, well, I get this tickling sound. I get this coughing. Oh, are you coughing or are you responding to a tickle? No, it's a tickle. And then when I get the tickle, I can't stop but cough. Okay, so you're not coughing, you're responding to a tickle. Yes, it's a tickling sensation. And is it on the left or right? No, it's somewhere down the middle. And so listening to the patient, I guess, changed my reality.
Wow.
Yeah.
And let's go deeper in there, because the idea of how do you listen well, because I know that's part of your book, right? That the idea of these patients changing you, and just it almost looked like the Socratic method you were going through there, right?
Yeah.
But I mean, and the reason I'm asking this is because I want to become a better listener, and you've obviously are, right? And so how does one who, and by the way, I want to add this comment, venture capitalists, I was a VC for a short amount of time. We do the same thing you do, and that's pattern recognition. So you look at the world, you pick out stuff, and then you try to pull it into, like you said, your view. And and then the real cool one is, but what's unique about it, right? Because you're going to bet on the game changer one. So how do you combine this highly skilled pattern recognition, just get it done, with this idea of opening up and listening? What's your technique?
Yeah, and so the vast majority of patients are going to have illnesses you've come across before. And so it is pattern recognition, and it has worked for hundreds of years. And when you've seen a lot of patients, you can recognize what is the uncommon attribute of this common illness.
I like that.
And so you know that a funny looking horse is way more common than a good looking zebra. And so if you know the disease really well, you've seen that unusual case and just pull it in. Hey, that's not a red herring, that's just part of it. But if you come across something you've never come across before, historically, the knee-jerk reaction is, okay, you're just making this up, you've got psychosomatic. And what I'm trying to say is, no, you have to listen, because you're at the boundary now, you're at the edge. There's something beyond what we know, and it's up to you to figure it out. And to figure it out, you're gonna listen, and they're gonna tell you the answer, right? Because the patient's living it every minute. Right. And you just gotta tell you why you don't listen. Time pressures of medicine, right? Time is money. I got another patient booked in 15 minutes. Okay, thanks for coming. And so you have to be prepared to just sit back and listen. And that's difficult in a busy practice, right? Because you're trying to move through, a bunch of patients that day. And so, yeah.
How about, let's get back to empathy. Then I have a really important question to ask you. But I got to go back to empathy real quick. You said that surgeons aren't necessarily trained to be empathetic. You're actually trained the opposite. And I don't think we were ever trained that way, but most fighter pilots that I know are fit into that criteria too. I call it compartmentalization. You can block out the world if you need to stay focused, right?
But what are you thinking about when you shoot someone down? Well, you're not thinking about their family.
No, you're just doing your job. You're executing.
You're doing your job.
Yeah. So you're exactly right. So you have to compartmentalize that. But that doesn't always work well for personal relationships. You can get right. So it's the same thing with the empathy, or really compassion. I've been playing with this idea that compassion involves empathy. Always it does, but it also involves wisdom. It's what you're talking about. Being empathetic, you just feel the other person, right? But when you're compassionate, you not only feel them, but they need some action. You got to take some course of action, which you might not know at the time, but wisdom. But so let's dive into that concept, because being an empathetic or maybe a compassionate surgeon, is that what you're talking about? Yeah.
I think that's important, because you are, it's hard work, right? And when you're young, you're just so focused on the technical aspect of it. I need to learn how to do this, surgeon. Don't tell me about don't overwhelm me with I need to learn how to do this operation. But the truth is, you're not just operating on that patient. You're looking after the family. That patient they have people orbiting them that you are going to profoundly affect. the spouse, the child. And so the truth is, there's a tremendous amount of compassion needed in surgery, but it can be draining.
Yes.
Right? If you take all that on your every single time, should I pull that tumor off? God, she's a single mom. Maybe I'll just leave it. You need at some point to compartmentalize. Let me do this operation as best as I possibly can, and then the rest will fall into place.
Okay.
But when you are dealing with the risks and benefits of surgery, you really are dealing with a family unit, not just a patient.
Yeah. Okay. Let's go to another direction real quick because I've been dying to ask this question.
Yeah.
How long does it take to form a habit?
Oh, wow. Yeah. It depends. Well, neurophysiologically, it depends on how that habit reinforces the reward center. So if there's a high powerful dopamine hit, you will create that habit very, very quickly. And the people who know about that is the gambling industry and the tobacco industry. They know exactly how powerful to generate that reward center hit. Yeah.
Oh, interesting. So it's all about that dopamine, like you said earlier, that reward center. So
yes.
if I can, okay. So when I asked this question before, someone asked me this. He goes, it was actually a neurosurgeon too. He says, Gucci, you're asking the wrong question. What you really need to be asking is, what are you trying to do? Because it's going to change, right? Which is what I heard you say. You thought for a second, wait a minute, what's the reward center? What are we trying to do? So let's unpack this a little bit more. Let's go to like a physical skill. Let's say you want to become really good at something.
So if you need to learn an operation and you're a fully trained neurosurgeon, we think about 30 cases to get up the learning curve. And you're still better at 100 than you were at 30. And then you get it's a incrementally better. It's a sinusoidal curve with asymptotically approaching perfection, never really touches it. Right. But you are actually better at 500 cases than you were at 100. Probably more in the office vis-a-vis patient selection than in the OR, dealing with that particular tumor.
Tell me more about that. What do you mean patient selection?
So there are some operations where there's no real patient selection needed. You have a brain tumor, you need it out. Whether you're young, whether you're old, whether you have a job, whether you're about to retire, you need it out. But there are other operations where it's more a question of quality of life.
I see.
So I spend a lot of my time implanting electrodes in patients with Parkinson's disease. Okay. And we call it deep brain stimulation, where we're implanting platinum wires deep in the brain, and we're connecting those wires to a pacemaker underneath the skin, and the electricity is driving the brain in the Parkinson's circuit, and it dramatically improves their Parkinson's. And so you're not elongating their life, you're not changing their disease, you're improving their quality of life. Gotcha. And what you need to know in order to offer that surgery is, am I going to improve your quality of life? And so you need to understand, well, what are the patient's goals? What would improve that patient's quality of life? And I'll give you a ridiculous example, although it happened to me. Patient had surgery. Parkinson's got dramatically better. Wife left him. The marriage was awkward. She felt duty bound to nurse him because he was disabled. No longer disabled, she leaves, and he's devastated. So his Parkinson's got better, but I ruined his life. That blew my mind, and so you really need to understand. That's a horrible example, but you need to understand what is your goals, and not just do the surgery because I know how to do the surgery.
Yeah. Wow. So I like that we're diving into the whole person concept, the mind, body, even spirit side. I don't know if you want to call it that, but as you're learning about, the diseases, I guess I'm asking a question is, sometimes the disease is not just a physical thing, right? There's the emotional, and there's, back to some of your comments, at least stress and these things. Do you see that? Is there a connection between a physical and also, say, a mental combination in some diseases?
Absolutely. And there are some diseases that are purely mental, not physical. So depression and all the mental illnesses are increasing dramatically in our population. And those are, I mean, we draw a distinction from history between neurology, where there's a physical something wrong, and psychiatry, where you can't see anything physical wrong, but the brain is not working well. The truth is we haven't gotten at a microscopic level to understand what's wrong. But all the psychiatric illnesses are going to turn out to be neurophysiological. There's something wrong with the channel. There's something wrong with the pathway. There's an overactive sadness pathway. Why do we have a sadness pathway? Well, we think we know why. And all those illnesses which are psychiatric, they have physical causes, but not at the present time. And so for sure, there are purely psychiatric diseases, purely neurological diseases, and they interact, the two of them.
Hey, I was wondering if you could help me on this, because this is cutting edge stuff. Where does gratitude come in to this concept of those neural pathways? Like Hebb's law, right? I've been told, right? Neurons that fire together, wire together. Did I get that right? Is that true?
Sure. Yeah.
So how can we look at this idea of gratitude or any positive emotion? How does that help our brain? How does that change the neuroplasticity, or does it affect neuroplasticity?
Yeah, I honestly don't know. Cool. I honestly don't know. And I'm not sure anybody does, other than on a philosophical level. Yeah, but we don't understand the neurophysiology of those very high order, gratitude, humility. That's very high order stuff.
Yeah, I think, and this is what's cool.
What is the neurophysiology behind altruism?
Right.
Why would an organism give their life for someone else? That doesn't make sense physiologically. That's high order stuff.
Wow. Well, why does it happen? What's your thoughts?
The suggestion is the genes of your nephew continue. The genes in your town, which you might have some play on from a previous generation coming down. So although you sacrifice your own genes, your genes are actually continuing through someone else's line. But that is a hard concept to answer physiologically. Why would an organism give their life for another one? Maybe that's why.
Wow. Yeah, that's I think about it from a standpoint of just flying next to somebody. You're going to do whatever you take to do your job and take care of them. You never really discuss it. It's not like you don't say, hey, I'll die for you if that's what it takes, but you will. And you don't unpack it, like, hey, I wonder why I would do that. You just do it, and I think of but now let's try to unpack some places so how can we take those beautiful concepts of altruism or of philanthropy or of teaching others? You do amazing work, right? Liberia, is that what you've been doing?
Yes. Yeah. The African country on the west side of Africa. Yeah. Which capital city is Monrovia, named after your fifth president.
Really?
James Monroe. Yeah.
But see, like you go over, I have a good friend, Jeff Tabin at Stanford, who does the same thing for cataract surgery, goes over to these countries and does what you do, teaches the doctors, doesn't just do the surgery, but teaches the doctors so that it can continue. So where does that come from? Where is that in you? Where did you decide? Because you could stay home in Canada, you could do the operations here. What drives you?
I haven't really said. I feel I should be lying on a couch right now.
You go, honey.
You're my new psychiatrist.
You go, honey.
So I would say I love teaching. Yeah. I want to pass on that knowledge. I was super lucky. My parents loved academics. So my dad was a teacher. I had the fabulous, schooling, growing up. And so I was lucky to get the training. I've been to Oxford. I've been to Harvard. I've been very lucky, and I want to give other people a chance to learn, and this is sort of my area, and so I actually really enjoy it. And the truth is, although you go over thinking, oh, I'm going to teach these people, how to do brain surgery, it's like, oh my God, they taught me way more. I learned so much more from them, not just about myself, but about medicine.
Wow.
Then it's a two-way street. So and life is meant to be lived, right? Don't sit on your couch and watch TV. Get out there and make a mark. Make the world better. So we found out that Liberia never had a neurosurgeon.
Wow.
Yeah, never had a neurosurgeon in the country. So we went over there and did some operations and helped out. The thing I didn't realize is we landed on the day Ebola broke out.
No.
Right, so there was a huge Ebola outbreak, biggest Ebola outbreak in the world in Liberia and Sierra Leone, right in that area. That was it 2014 around March. And when we landed, there was no news about Ebola locally in Liberia, but my wife phoned me and said, did you know there's Ebola in Liberia? And I go, no, it's not in any of the newspapers, but they were suppressing it in the newspapers. They didn't want, people to panic. And Ebola is a bad virus because it kills you too quickly. It has a 90% death rate, and it doesn't have a chance to, pass on. It's as opposed to influenza, where, you're going to pass. So Ebola is historically not a clever virus. It's too deadly, right? It kills its host instead of just passing on. So the government, after a couple of days, there were no more, like, everybody died, right? The first outbreak, everybody died, and the government thought, oh, okay, that's gone. But what happened is a couple of people got through, and then it exploded while we were there. So that was actually, that was scary. Yeah, that was scary because it's out of your control. You know what I mean? It's beyond your tolerance of safety.
Yes. Maybe that's good. You just hit a point out of your control. So neurosurgeons.
I hate that.
Exactly.
That's the worst. That is the word. I don't like that at all. But it spills over into life,
Yes.
Yeah.
So how do we, and by the way, I am trying to pick your brain because I want to unpick what's the qualities in a person like you talked about Oxford and then Harvard and doing the brain surgery and being driven and wanting to get better and having this, but also having a joyful life. Also about, making an impact. I like to say I want to inspire 1 billion people to live and give life in all its fullness. And that means to live it. I mean, have fun, man. Enjoy life, but also give it to somebody else. That's kind of just a mantra that I have for myself. Do you have any mantras or, sayings that you have really made an impact in your life? And it could have come from your mom or your dad even,
Well, I think probably the concepts are in there, but haven't been articulated or crystallized. I learned a good one just recently. Glad to be here. I mean, some of your philosophy is just taking the words out of my mouth. I've never been able to write it down how I think, but those are, I'm grateful. I'm grateful for my education. I'm grateful for my wife and family. I'm grateful for the people that I work around. I originally, I was drawn to neurosurgery and at a very young age. I'm not entirely sure why, but at grade 6, I made my decision. Grade 6.
Grade 6.
So grade 6.
What is that?
That seems 12, a little early,
11? But how old are you?
Yeah, so 6 + 5, maybe 11-year-old.
Okay, got it. Yep.
And subsequently people said, oh, that's sort of like a priest's calling. You don't know why, but you just know that that's meant for you. And originally I liked drawing the brain. I thought it was really cool. Then later on, I thought, it is so complex that even some guy like me could maybe discover something new. There's so much we don't know about it. I thought I might get bored taking out my 100th appendix. but I thought I would never get bored, operating in the brain. It's just too complex, too different. And then maybe later in my career, I liked the juxtaposition of intellectual challenge and physical challenge. That sort of appealed to me.
Yes.
But more recently, I enjoy it because of the people I work with. The patients I meet and the team that I work with. It just is lovely, right? It tends to attract a certain person, people who care about doing really well. They're not just putting in time; they're trying to be good at what they do, and I just love that, being around that energy.
Wow. It's interesting, 11 years old. So my dad took me to an air show when I was 11. I hadn't turned 12 yet. And that's when I saw the Blues and said, I want to do that. And I think that there's something interesting. Have you seen any studies on when are you most impacted in life? I heard that age is a very magical age.
I didn't know that. Yeah, I didn't know that.
It may be just it probably not even a study. It's probably just more anecdotal. But it's interesting how when does someone get inspired, and then if you're not, then that's okay too. Because let's talk about inspiration. That you just hit me on this. What is the brain? Okay, because when you say neuroscience, all right, is it just this brain up here, or no? It involves more, right? The spinal column and other things. I mean, when we're talking neuro, what are we talking?
Yeah, essentially brain, spinal cord, and peripheral nerve.
And peripheral nerves. Okay, so how do you inspire? So how does the brain become inspired? What happens when you're an 11-year-old boy and says, I want to become a brain surgeon? Do you know? Like,
no, that is high level stuff. Yeah. I think the philosophers might be able to answer that question, but the neuroscientists can't. Yeah. Well, and one day they'll talk to each other.
Yes.
And one day they'll talk to each other.
Well, I think it's happening. I really do. It's kind of cool, right? When you see these philosophies, I know the Dalai Lama has a secular thing where he is trying to bring science into that philosophy, right?
Yes.
And I think we all need that, because some of us can just believe, we have faith. Others need the science, right? And I kind of try to do both, but I think if you can back it up, it really matters, right? It
Agreed.
really matters.
Agreed.
So, all right. Well, give me a story. You said people impacted you. We only talked about that one lady, but what have you learned from others?
Well, I've learned a lot about medicine. I mean, I'm in medicine, and that is my world. And so I've learned a lot about the science of medicine from just listening to people. And the diseases that we've really discovered them because we just listen to people. And some patients who don't quite fit any specific illness are often blown off, and then maybe even doubt themselves and feel like it. But the patients that I met early on, especially a few of them, fought to be believed. And they're fighting the medical system. And that's a pretty powerful system, which has routines, and then you get blacklisted. Oh, this is a difficult patient. And I thought, I've been impressed and inspired by patients' tenacity to find the truth, to keep digging away and make someone believe them. And that's why I wrote the book, because those patients inspired me, and I wanted to let other patients know, you're not alone. And I would encourage you to have a voice, to believe yourself, and to tell your doctor exactly what the problem is, and someone's going to listen.
Let's talk more about your book, The 10th Nerve, because what you just said is huge. As a patient, the doctor, especially if it's a neurosurgeon, has this authority figure to you, right? And so what can a patient do to believe, to speak up for themselves and not just get sucked into the system?
Yeah, they just have to have the confidence to say, look, and look the surgeon in the eye and say, I need you to listen to me.
I
I'm
need you
going
to
to
listen.
tell you, I'm going to tell you my story, and I'm hoping that you're going to listen to me. And you're fighting against time pressures and preconceived ideas in that surgeon's mind. But if you can meet them at a human level and say, look, I want you to hear me, and I'm going to tell you what's wrong.
Yeah. Hey, what inspired you in your life? So you're this, I want to get back to your childhood, or not childhood, but just your life, because you became a diver. Hold on. I mean, this is incredible. You say, I want to be a neurosurgeon. You became an Olympic diver. Okay.
Yeah.
I mean, you look at some of these pecking orders. Give me a couple of life stories, and here's what I really want to know. How did you deal with obstacles, failure?
So I think it's just a personality, a trait. I want to be very good at what I do, and I'm prepared to put in the time, and I like that concept. And so diving is a bit of an esoteric sport. It's not like football or hockey where everybody plays. And so if you put in the work, you can rise fairly quickly. And I like the idea of I've always liked motion, and for me, sports has been is my big outlet. So there's a lot of stress in neurosurgery, and I love sports because I like to play it at a level where I can't think about work. I've got to think about the sport, and it's completely flushes my mind of the stress of work. And you're supposed to stay healthy, and I love sports. So I play soccer, I mountain bike. I like to swim. I used to do Ironmans. And then I dove in the Olympics, and I really love sports. Yeah, that's my well, except for you and the psychiatric couch, it's sports. I got nothing else decompressing me.
Hey,
Yeah.
when you're in that state, whether it's in sports or, and again, it's this idea, a flow state. I'm trying to get into your mind where you, what does that mean to you when the difference between being intellectually present and just being present? The question I'm asking?
No, but I can tell you one thing though. In sports, there are some sports that happen so fast that you cannot have your frontal lobe or the cerebral cortex involved.
Oh, there you go.
Diving is one of those sports. So I think this isn't in any textbook. It's just my personal opinion. So it could be complete garbage, right? But I'll tell you, diving happens so fast. People talk about muscle memory. The muscle itself has no memory, but the cerebellum, it's a small part of the brain. It has more cells than the entire cerebral cortex up front. Evolved later in mammalian development, and it handles coordination of pre-patterned motions. And a dive happens so fast that you can't think, and get it down to, do you know what I mean? It has to be almost automatic, but it's actually happening at a lower level. And I think I'm going to go a little bit further out on a limb. There are some people who have phenomenal cerebellums. They make superb athletes. And for me, if I tried to think in the middle of a dive, it was a disaster because I was 2 seconds too late. I had to go with the flow. And that enabled, and you almost had to practice getting in that Zen-like space where you're unaware that your mom or your wife or whoever is watching you're just in that moment and go through that motor pattern. And if you are truly deep in there, you're not thinking about your day's work. And you come out, you're physically, tired, but you're intellectually flushed. And so I used to train twice a day. And then in med school, I would finish med school, a second training, and then the evening I was ready to go again. I'm completely refreshed intellectually. I want to learn. You know what I mean? Yes. It wasn't like, I need to sleep. It was like, for me, it was a way of refreshing my mind. And later in my career, it was a way of flushing out the stress of, and I don't know about you, but we've got bureaucracy in medicine. we got we got too many bureaucrats and not enough doctors, and so there's. I think that's a universal, except in Liberia. Even in Liberia, there's more bureaucrats than doctors. And so, in order to flush out that stress, I use sports. I love sports. It's just my hobby. So I like it.
Well, you helped me a ton here because exercise sports. It's so healthy for lots of reasons, right? But I like what you said is it can reflush, the stress, right? Because you're working hard. How do you wake up in the morning? Do you have a morning routine? How do you get yourself into that zone that you need to be?
So we don't operate every day, right? I only operate 2 days a week, and other days I see patients and look after them and that. And so on a day when I'm not operating, I start the day with sports because stuff happens. Right. Stuff happens during the day and, I don't have time to, go do any athletics. But if you get it in the morning, you're done. Right. You've gotten it. On the days that I operate, we start 6:30. And so I would just start with the surgery and then I would do sports at the end of the day to get that day, out of my mind. So I can, relax in the evening and not be going over and over and over things. Those are just individual routines. It works for me. I'm sure it wouldn't work for everybody, but it works for me.
How do you sleep?
And routine, routines work. Routines work because you're going to get more stuff done if you have a pattern and stick to it. And so I have my patterns and I stick to it and I get a lot done.
Got it. Hey, as we wrap up here, what does glad to be here mean to you? I mean, I think about what you do in the world, what you do for so many people. When you see this saying, what does it mean to you?
I think you have to step back and be grateful for the opportunities that God and life, have given you. It's easy to just be blasé about it and grind out another day. But, I am able to operate because my parents liked education. I was born in the right country. If I was born in Liberia, I wouldn't be a brain surgeon. And so I'm grateful for the opportunities that life have given me. And I think that's positive. When you actually stop and think about how lucky you are, you get a hit of appreciation. Yeah, and so I think it's important not to be blasé about these things. That you need to be glad to be here.
It's that dopamine, but is it always dopamine, or you think there's something else that's reinforcing that?
There's far more than just dopamine. Yeah. I think we're just starting to learn the reward pathways, but all our knowledge comes from rats. And mice. So I don't know. I know a lot of people who are rat-like, and but I think that's much more than that. But we're trying to simplify it so that our brains can understand it. But I think being grateful, and it that mimics some of the great truths in the big religions of the world, right? Exactly. And they've come to those truths from thousands of years of sort of thinking about it. And all these ideas are coming towards each other because I think they represent fundamental truths. Yeah.
And I think that's the key, is it's coming together and bringing us all together, because it doesn't matter where you live. You're in Australia right now. It doesn't matter who you see. People, I think, are more similar than we are dissimilar, right? And connecting.
Well, it's interesting, your book, for example, there's so many things ring true in my world. And, I've never been in a fighter plane before, but that guy knows that makes sense to me. So I think they're just fundamental truths, and you learn them, from wherever you're coming from, as a philosopher, as a fighter pilot, as a brain surgeon, as a CEO. You probably learn these fundamental truths.
Yeah. And I love it the most when you kind of say, oh yeah, I always kind of felt that. I always kind of knew that. It just never was articulated necessarily.
Yeah. Well, you have written it down in words. You know what I mean? It sort of crystallized it. I like that.
Nice, nice. Hey, now speaking of your book, The 10th Nerve, you were just saying it's now in the United States, just the
Yeah.
last 2 weeks, right?
Yeah.
So let's talk about it. Where can I get it? Amazon?
Amazon. Yeah. Amazon.com. The 10th nerve. The 10th nerve is the vagus nerve. It's part of one of the nerves coming out of the brain.
Oh, it's
And
the vagus
we have
nerve.
12 cranial nerves. The first one is your smell, the second one's your vision, and all the way down. And the 10th nerve happens to be your vagus nerve. And the vagus nerve, if compressed, caused these unusual symptoms in our patients that no one recognized until some patient forced me to understand that it was their vagus nerve that was compressed. And so it's really an homage about a series of patients who changed me as a surgeon, as a person. Yeah.
Whoa, I didn't realize the 10th nerve was the vagus nerve. I've only heard that term. My wife, well, you know, when they say you vagal, you know, or
Yes.
something like that.
Yeah.
So what does it mean? What does the vagus nerve really do? And how do you know if you're having a pinched vagus nerve?
Yeah. Yeah. So the vagus nerve is the longest nerve. Vagus means the wanderer. It comes out of the brain, it wanders all the way through the body, and it basically it has multiple nerves listen and nerves do. So the listening part of the vagus nerve, it's listening to the body. And so when there's something wrong with the organs or something wrong with the blood pressure or something wrong with the body, that information is going to the brain via the vagus nerve. And so that's why the vagus nerve is a lot in in Buddhism, listening to the body. And also the vagus nerve then sends information to the body. So for example, one of the things it can do is it can slow the heart. And so those Buddhist monks who can slow the heart have tapped into their vagus nerve. It's unusual to have voluntary control of your vagus nerve. It's usually an automatic thing. And so they've tapped into that, and they can actually slow their heart, profoundly. But the vagus nerve controls the gut, movement of the gut, which you can't normally think about, but the gut is actually moving through the vagus nerve. It controls your voice box and the muscles of your throat. So it's important with swallowing. And so if the vagus nerve is pinched and the muscle and the nerve is firing, you get these throat contractions that you don't know why. There's nothing wrong with your throat, but because the vagus nerve is firing off, you're getting these throat contractions. And that was the sort of the premise of the disease that we found, which was subsequently called hemilariнгopharyngeal spasm. It's a mouthful, but the short form is HELPS, hemilaringopharyngeal spasm, HELPS. HELPS syndrome was the condition that we discovered. And then vagus nerve also does sensation to the lungs. So if and the sensation to the lung is tickling. So if you swallow a fish bone, it hurts if it's in your throat, and it hurts on one side. And it probably does that because you might be able to reach in and pull out that fish bone. But once it gets beyond the vocal cords, you can't get it out there. You have to cough it out so that it no longer hurts. A child who swallows a coin doesn't say it hurts, it tickles. And it's triggering a cough, which is probably phylogenetically the only chance you're ever going to get that fish bone or out of is by a cough. And so if you bang your elbow and get tingling in your hands, the analogy is if you bang your vagus nerve, you'll get tickling in your lungs. And so there's a condition that is being more frequently recognized recently by our ENT folks, and that is neurogenic cough. So coughing that has nothing to do with an infection or asthma or COPD, but for some reason they got this chronic tickle. We think it's because the vagus nerve is pinched and you're getting the equivalent of that funny bones sensation in your hand, only in your lungs. It manifests itself as a tickle and you can't stop coughing for some reason. And we think we know we found the cause, and we're trying to disseminate that knowledge. But the cranial nerves, there are 12 of them. They were numbered in the 1800s, and the 10th nerve is the vagus.
Wow.
I was originally going to call the book Brainstorming because we were thinking about the brain, but the editor said, no, that'll be a business book. You'll never sell it. No, can't call it Brainstorming. Got to call it the 10th nerve. So anyways, the book is called The 10th Nerve.
I love it. I'm going to go on Amazon right now and order it.
You're good. You're good.
And I hope everybody does. And it'll be in the show notes. What's your parting thought? Is there any philosophy, any life skill that you want to leave the audience with?
Wow. I wish you'd told me that a couple of days ago so I could think about it. I would say be humble, but don't dare to be great.
Wait, be humble, but don't dare to be great. Oh, I love it. So dare to be great and be humble could be another way of saying that, right?
Yeah, well, you're going to say it better than I will, but
I love that. See, that's it. And I can feel that in you. You know, I can feel it in it. And by the way, call sign Honey, even though Dr. Chris Honey and Gucci, I can feel it in you. And thank you so much for what you're doing out there in the world. Thanks for being on this podcast. It's early morning, Sydney. You're helping people around the world. Glad to be here, Doc. Appreciate you.
God bless you. Thanks, Gucci.
Glad to be here.
Honey signing out.